So today, Doc wanted me to talk about something we get asked about all the time, and that is pain. Pain. And so, our program here has helped thousands of people through the years, and we're also going to share with some information that you might have never seen before when it comes to the medications as well, including aspirin and how dangerous aspirin can be. Okay? So, really this inflammation is the root of all problems, all chronic health issues is inflammation. The way the presentation is it's geared toward joint pain and osteoarthritis, but we can use this for any type of inflammation initially. But the whole idea is to rebuild your joints naturally and increase mobility. And as we know, if we're looking at the structure of a knee, we know there's a lot of things going on here that can happen. Torn cartilage, damaged cartilage can occur, wear and tear on your tendons, your ligaments. Lots of reasons for this purpose, but the whole idea is to actually regenerate and rebuild. And there's a layer of fluidity that goes on here between your bones and your joints called the synovial fluid. And what we're trying to do is rebuild that synovial fluid, okay? And when that happens, you're not as much as pain, there's no friction going on. So a lot of times doctors use that expression bone on bone, right? Oh, you have bone on bone, there's nothing we can do, you're gonna need surgery. And you know, my always response to that is, if you have true bone on bone, you would not be able to stand, let alone walk, if you actually had true bone on bone. Just because they can't see the cartilage on the x-ray doesn't mean there's no cartilage there. There is, just limited, but we can really help to rebuild this over time. Now, you didn't get the knee pain in a day, so you have to give us a little bit more time than a day. Typically 2 months are where the studies have been shown. But before we even get to that point, we want to reduce the inflammation on a cellular level. And then when we take things like our HA Plus to help to rebuild it, you're going to get even faster, quicker results with this type of arthritis type of pain. So let's just give you a little definition here on inflammation, a little background. The word itself comes from the Latin, inflammare, to literally set on fire. And so the whole inflammation process is a whole cascade of events that can happen either to injury or trauma or chronic over time. But those can occur, physical, chemical, or biological events trigger this, can occur acutely, or as I said, over a lifetime of wear and tear. So the initial changes are not only to your tissues, but on the cellular level, and blood vessels themselves are inflamed around the area. And so the whole idea is that you need initially knee pain to begin the repair and healing process. So many people, they want to avoid that pain. And I understand pain, obviously, you know, we don't like it. Nobody does. But should be some type of initial pain to begin this whole entire healing process. So, a lot of different signs and signals for inflammation: redness, heat, swelling. These are all can occur all at once, or any of these can occur at any time. All right, so your major players in your inflammation are in your white blood cells. Okay, they release these different inflammatory mediators, and these are known as cytokines, leukotrienes, and prostaglandins. These are what drug companies are testing for when they're testing medications. With our supplements, we also have tested these same exact markers. And guess what? We can reduce these naturally without any side effects whatsoever. So when a medical doctor says there's no research on supplements, he's just not aware of the research. He has no nutritional background, so he just likes to make those big statements which are not true. He's just not aware. So my job, my role of this company is to educate the doctors, is to show them this research that we're going to go over today, that there is plenty of it out there. They're just not aware of it. So these mediators induce increased blood flow to the area and leakage of the fluid in the tissues, resulting in symptoms of inflammation. So the classic example of this would be a sprained ankle, right? You twist your ankle, a lot of fluid is in there, a lot of pain, a lot of swelling, okay? And so that's what's happening here, that increased blood flow and leakage to the area. So we're trying to reduce all of that, and we can do that naturally with this. But if we take a look at all symptoms of inflammation, again, we've touched on several already. Obviously the joint pain and stiffness, the swollen joints, the loss of function, flu-like symptoms can occur, chills, decreased appetite, okay? On the osteoarthritis level, the wear and tear of the cartilage itself. But then there's other types of inflammation. And these are known as autoimmune diseases, where your body is attacking itself for some reason. Usually it's food. There's food triggers this inflammatory response. So with all of our programs, we try to remove all dairy, all gluten, all soy protein, all corn, and all sugar. If we can remove those 5 things, a lot of these autoimmune issues go away on their own, because these foods are your top foods that trigger this inflammation. But there's over 90 classifications of autoimmune disease now. Everything from GI issues, colitis, Crohn's, irritable bowel, rheumatoid arthritis, okay? But there's many, many, many others out there. But that's why with our programs, we try to do what we call food elimination, and you're going to get even faster, quicker response from whatever issue might be. All right, so if we went to a conventional medical doctor and we had an injury, this is what their typical approach is, right? Rest, exercise or physical therapy, medications, if that doesn't work, surgery, right? So that's all part of the standard operating procedure. I think we all know that. So the first approach typically is your non-steroidals, NSAIDs, okay? Aspirin, ibuprofen, naproxen, Tylenol. These are your more common ones there. If those don't work, then they move up to the corticosteroids like prednisone. If those don't work, then we go into hardcore drugs like methotrexate. Methotrexate, folks, is a cancer drug. If you actually read the side effects and warning label on methotrexate, the first thing it says is, this may cause cancer. I was just talking to a woman earlier today. She has rheumatoid arthritis, and they have her on methotrexate. And she doesn't want to be on methotrexate. I'm like, why are you taking it? Well, that's all they're giving me. How long have you been on it? 3 years. 3 years. I said, there's a lot better things than methotrexate. You know, but they put that fear on you, and I understand that, a lot of pressure, but there are some natural ways. So, and we're going to talk about those. All right, so with these drugs, of course, come the side effects. So with the NSAIDs, one of the biggest problems with the NSAIDs is GI problems. Gastrointestinal bleeding, ulcers, little perforations, acid reflux. So all those different types of GI problems, it's due to increased use of non-steroidals. So for anybody who has seen this presentation before, do not answer this question, but anybody new, how long should someone be on an NSAID? Maximum amount of days. 30? 30 days? Anyone else? Anyone else? Guess? 10? Never? Okay. The research shows 3 days. 3 days on an NSAID. Maximum. It says it right on the insert. It says it right on the directions. Do not take for more than 3 days without consulting your doctor. There are studies that have shown that we've seen where actually GI bleeding can occur after just 3 days. Okay? 3 days. Then you have some kidney problems that occur a few years ago. This is a while ago now, about 10 years ago. And if you remember this, anybody who follows basketball, there were two very famous basketball players, Alonzo Mourning and Sean Elliott. These are all-stars, NBA all-stars. They were in the prime of their career, and they had to retire from basketball because they were getting kidney failure. And why? Because they were taking NSAIDs every day for their pain. So this made news for about a day or two and then gets swept under the carpet. This is a big problem with athletes. And they're using these along with several other pain type of situations going on. But the next step is the corticosteroids, like prednisone. Very common. Corticosteroids have a host of other issues, side effects, long-term use, right? Nervousness, trouble sleeping, increased appetite, fluid retention. So a lot of people who are on prednisone increase weight, have a real puffy face, just like, for example, Jerry Lewis. Jerry Lewis, heavy prednisone use, right? Classic example there. Dizziness, increased susceptibility of infection because it's destroying your immune system, by the way. Increased stomach acid secretion. Osteoporosis is a big problem with prednisone. Cannot absorb your minerals and nutrients. Diabetes. Being on prednisone will cause type 2 diabetes. Cushing syndrome and irregular periods for females. And so with Cushing's, we're talking about your adrenals. Affects your adrenals. So, host of problems being on prednisone. I should also add on there, candida. Being on prednisone will cause candida as well. So, not very good. Now let's go back to the NSAIDs here. This is what I was referring to, and I put this document on the back page here for you. Back in 1999, 97 actually this is 1999, New England Journal of Medicine, they did a study that showed the amount of people who die from NSAIDs in the United States, taking it normally at the prescribed medication, is the same amount of people who die of AIDS worldwide. 16,500 deaths occur yearly from taking your ibuprofen the way it was prescribed to you by your medical doctor. Okay? Gee, I missed that in the news, this particular one, right? Didn't hear about that at the 6 o'clock news. I didn't see that in the newspaper, this headline. Now, if this was a vitamin, oh my goodness, it would be all over, right? But people are dying from taking aspirin every day. People are dying from taking their Tylenol and ibuprofen.
They were probably taking it because they were in a lot of pain.
Yes, they were, because they did not know there were some natural options out there, and we're going to show you those natural options. But this is how dangerous these medications are, long-term use. They were never intended for long-term use. And some of the newest information out there with aspirin is that taking it a regular aspirin a day can cause 400% increase in macular degeneration. Taking a baby aspirin a day has a 200% increase of macular degeneration. Okay? There are pharmacists that I work with that told me if aspirin was today new, if they just discovered aspirin today, it would be classified as a prescription drug. But it got grandfather claused in by the FDA, our Food and Drug Administration, which is supposed to be looking out for our best interests, right? Nope, aspirin got grandfather claused in. And just past summer, they changed, the FDA changed the way your doctors are supposed to recommend aspirin. It's not the initial first treatment anymore. It's not. Very few newspapers and media outlets talked about this. That's how dangerous, folks, these NSAIDs are. They're only meant to be taken 3 days maximum. Now, that's 1999. So here's more recent data. So this was in a 3-month time period. This is FDA's own adverse event reporting system. This is public knowledge. Anybody can look this up. So this is what was reported. This is a 3-month period, January to March of 2008. So in those 3 months, from taking your Tylenol, 1,500 deaths were reported. Another 1,400 disabilities. Aspirin, 716 deaths. Another 600 disabilities. Ibuprofen, like Motrin and Advil, 357 deaths. Another 340 disabilities. And Celebrex, 119 deaths. Another 91 disabilities. Of course, the problem with Celebrex can give you a heart attack. Okay? Again, I don't see this in the news. I don't see this or hear about this on the radio. I wonder why that is. Wonder, right? So, this is scary, folks. That's why we're telling you. You don't hear this information. That's why we're sharing this with you. It's public knowledge. You just have to know where to find it. And so, keep that in mind. All right, so at Nutritional Frontiers, we're trying to come up with a natural solution. And that's where we created X-Flame. X-Flame. So this is in place of your NSAID, in place of your Tylenol, ibuprofen, reduces pain and swelling, increases mobility, gives you all the natural benefits without any of those side effects like death as a side effect. So X-Flame, if you're not familiar with the ingredients, here they are, quite a few. Some of these things you might have heard of before. Some of these you might never have heard of before ever. So we'll go over them. Cresellazine, dimethyl glycine, DMG, turmeric, boswellia, quercetin, rutin, ginger, luteolin, and cayenne. So what's that? 9, 10 things, ingredients. Some of these ingredients and herbs have been used for thousands of years. Some are relatively newcomers to the nutritional industry. But every one of these has research to reduce pain at its source on a cellular level. Okay? All right, so this first ingredient, cresellazine, you probably have never heard of unless you heard me talk about this before. Cresellazine is an all-natural ingredient. It's basically a fatty acid combined with a creatine, pH buffered form of creatine. And this has a U.S. patent on it to reduce inflammation, increase flexibility, and modulate pain. So that's a health claim. So we can actually make a health claim on a natural ingredient. And if you know anything about the patent process, number one, it costs a lot of money, millions of dollars. Number two, you better have the research to back that up. Okay? So typically a nutritional supplement will say on the back, may not prevent, treat, or cure disease. Cresellazine doesn't have that disclaimer because it's actually can make a health claim. And there's lots of research on this. We'll show you one study here in a moment. But this is a relatively newcomer to the nutritional world. It was actually introduced in 2008. So that's why a lot of people might not be familiar with this one. And definitely a medical doctor has never heard of this unless I show it to them, unless I actually specifically meet with them. Okay, so here's one of the studies just on this first ingredient, cresellazine. So this is a double-blind placebo-controlled study. In this study, people who had previously been on an NSAID, okay, then they started taking cresellazine. After 30 days, they just asked them to compare. How do you compare this to your Tylenol? How do you compare this to your naproxen? For ankle and foot pain, 100% of people said it was just as good, if not better, than their drug. For your other extremities, neck, shoulder, elbow, wrist, and hand pain, 80% said just as good, if not better. And for knee pain, 71% said it was just as good, if not better. If you average it out, averages out to 75% of people in the study said it was just as good, if not better, than the drug with no side effects, like death. Okay? So when we first saw this, we're like, yeah, that sounds a little too good to be true. So one of the great things about this clinic is that this is real people, real world. A lot of these type of studies, it's very small sample, and they pay them, and you don't know how much is bias involved, right? So we actually did our own in-house pilot trial on just this one ingredient here at the clinic. On a much larger sample pool, we tested this on 144 people who were on an NSAID. We asked them the same questions, and we got exactly the same results. And that's when we said, we're onto something. We need to use this in this formula, okay? So that is the first ingredient. Here's some testimonials from the studies. Here's one with bilateral arthritis and swelling in knees. Corticosteroids was better than any drug I've ever used. Here's one with shoulder pain, did what the drugs couldn't do, increased mobility, actually could live a normal life. Here's another one, back and knee pain. Worked so well, I did not notice the pain at all during the day. It took about 3 to 4 days to kick in, which is usually that's what we can expect, 3 to 5 days. So it's not over, immediate like an aspirin. Not going to give you that immediate pain relief, but on a gradual level, within 3 to 5 days, this really does seem to work. Although I have had some cases where people did see it almost immediately. So that's just the first ingredient. The second ingredient is dimethyl glycine, originally called vitamin B15. The previous person there spoke about he used this ingredient, among other things, to help him with his cancer. This is the only supplement that I'm aware of in the United States that we can make a health claim to treat cancer with. Now, the U.S. patent on it is specifically with melanoma, but we use this with all cancer patients. So that is really powerful. But there's also 2 other patents on this. There's a patent to treat all arthritis and inflammation. And there's another patent to boost your immune system and for the treatment of all inflammatory disease. So DMG, I can do a whole presentation on just this one ingredient. We won't for right now, but I could. It's one of the most powerful supplements I've ever seen is DMG out there. But what's really unique about DMG, this is your master methylator, okay? Which means is that when you combine this with any other supplement, it will enhance that supplement and make it much more efficient and much more absorbable. So we use this in a lot of our formulas. So we sell this just by itself, or we have it in this formula, the X-Flame, because of that benefit. So both of these have U.S. patents, Corticosteroids and DMG, okay? Let's go back. And so there's a lot of supplements out there for pain, okay? But X-Flame is the only supplement that I'm aware of that has 2 different patented ingredients, the first 2, that we can make health claims to treat pain with. Okay? That is what truly makes X-Flame unique and different. So when people say, well, what's the difference between this and, something I bought off the internet? I'm like, well, what's in it? Do those have the patents? Do those have the ingredients? Then we look at the other ingredients, the herbs, turmeric, or otherwise known as curcumin, boswellia, quercetin. Those have all been around for thousands of years for reducing pain and inflammation. Okay? Rutin, good for on a vascular level, strengthens your veins. Ginger has a lot of great properties for inflammation. Luteolin from perilla seed also helps more on inflammation with the lungs, so we're covering a lot of bases. In fact, we've had people who've used this with their asthma that this has helped out with as well tremendously with their asthma, because that's an inflammation of your lungs. and a little bit, just a tiny sprinkle of cayenne. And the reason why, if you add cayenne, the research shows that it will enhance your turmeric, your boswello. Okay, so in your curcumin there. So that's why we added just a dash of curcumin in this formula for you. So there's no other supplement out there that has every one of these ingredients in it, in this combination at this dosage. But here's how we take it. If you're in pain, we want to do it 3 times a day, okay? If we're doing the powder, 1 scoop is 1 serving. So we're doing 3 servings a day, 3 scoops a day. 1 scoop breakfast, 1 scoop lunch, 1 scoop dinner. Until you feel that pain relief. Some people it's next day. Some people it's 3 days. Some people it's 5 days. Everybody's a little bit different when it comes to pain. But this is how we take the powder. We just need to take enough of it. Whenever I talk to somebody who's tried X-Flame and they say it's not working, I say, how do you take it? And 99 times out of 100, they're not taking enough of it initially. Okay? Once you feel the pain relief, then we back it down to 1 serving a day. Okay? So I'm just going to pass that around for you. On the powder, we have it in the capsules. So in the capsules, 4 capsules equals 1 scoop of the powder. So if we're in pain, we're doing 4 capsules breakfast, 4 capsules lunch, and 4 capsules dinner. 12 a day. 12. 12 a day initially. Then once you feel the pain relief, then we back it down to 4 capsules. 4 capsules. So 2 breakfast, 2 dinner. But we have to start very aggressively initially for this to work. Okay? Well, again, it's only enough for you to feel the pain difference, and then we're backing down off the dosage. So there's 30 servings. If you're doing 3 servings a day, that will last 10 days. But most people feel it in 3 to 5 days. Some people feel it in 1 day. And then you back it down to 1 serving. Okay? Now, because of the fatty acid in there, if you're on Coumadin or warfarin, a generic nerve, there's the capsule. Okay? If that is the case, we have another option for you for the pain, the acute pain, and that's Inflame. Inflame. So this has a lot of the same herbals in there. It doesn't have the DMG and it doesn't have the creselazine. That's the primary difference. But we've also had some really good results with this. The way we would dose this is 6 a day. 6 a day if you're in pain, then we back it down to 2 a day once there's pain relief. But if you're on Coumadin, this would be the one that we would recommend, would be the Inflame. So that's the difference between the two, the difference between X-Flame and Inflame. Does that make sense, everybody? Everybody got that? Okay. So this is a natural aspirin. It's not aspirin. So we want to make that clear. This is much safer for you than an aspirin. But this is for that acute type of pain situation. Okay? That's how I would explain this to people, X-Flame or the Inflame. Now, to rebuild those joints, to rebuild the cartilage, would be our HA+. And our HA+ of all the supplements in the clinic, and there's over 1,000 supplements on the shelf, this is our #1 seller. And it's been our #1 seller for the last 7 years, as a matter of fact, HA+, because it works. It is absolutely amazing for all joint pain, osteoarthritis, rheumatoid arthritis issues, because of course, what's in it, the ingredients, okay? But this is a special type of hyaluronic acid called BioCell Collagen Type 2, which also combines not only HA, but chondroitin sulfate. Then we added the glucosamine, we added MSM in this formula. So BioCell here is really the key ingredient, okay? So it combines collagen, chondroitin, and hyaluronic acid, as I said, easily absorbed into the GI, tract. This does come from chicken. Okay, is the source on this.
That in the HA?
This is an EHA plus. This is an EHA plus. No adverse reactions, no toxicity issues, no interactions on this to be concerned about. And it is generally recognized as safe by the FDA. So not only is it going to help with the joint, promotes that joint comfort and mobility. Again, it replenishes that synovial fluid, that layer of fluid between your bones and your joints that we talked about at the beginning. It also helps with cushioning as well as that lubrication aspect of it. But over time, it's going to strengthen cartilage, strengthen tendons, strengthen ligaments as well. One of the other amazing benefits about HA Plus is for the skin. And so this is the only hyaluronic acid on the market that you could, studies have shown that you can take orally, okay? You can swallow it, and it's been shown to reduce wrinkles. There was a very famous study done a couple years ago at a dermatology conference which showed that this form of hyaluronic acid has been shown on that. So this is what we like to say is a positive side effect. Not a negative side effect, but a positive side effect. It's not going to help with your joints, it's also going to help out with your skin. Also hair and nails also might improve. So when we do a comparison compared to other glucosamines that are on the market, the form that we're using is the best form there. All the research and data to regenerate it. There's other forms of collagen on the market, but this form has the most research out there. So we're just doing a little comparison on this slide. Okay? So again, all the benefits, as I mentioned, lubrication, protection, and metabolism. In fact, it has a detox property to it. It removes waste from the joint capsule itself. Most people do not know that about hyaluronic acid, but yes. Now, here's why this is so much more effective. There was a clinical study done in 2004, double-blind clinical study, that showed that this particular form of hyaluronic acid had the most amount of absorbability than any other form out there on the market. And that is why we're using it. That's why Dr. Weiner recommends this every day on this. But in 36 hours, it showed that it significantly increased in the blood. It peaked within 12. But here's the key here, that they are using technology that shrinks the molecule 600 times. And therefore, you get much, much greater absorbability than any other hyaluronic acid. Okay? So that is what makes this truly, truly unique, folks.
And they know that how?
The testing, blood testing. And this is patented technology that literally shrinks the hyaluronic acid. The metabolite. So they breaks down hyaluronic acid, was breaking down into two metabolites, and those were 1/600th the size. So therefore, that is what you're actually absorbing into your hyaluronic acid. BioCell is a combination of hyaluronic acid and collagen and chondroitin.
But he breaks it down. Breaks what down?
This particular form does this process. And it shrinks, it's able to shrink it 600 times smaller. And so that is what really makes this unique and different. Okay? Now, it takes about 28 days.
It shrinks the inflammation or the thing that's causing.
It shrinks the hyaluronic acid to get into your blood. That particular form is small enough so you get maximum absorption into your cells. Okay? And then once it's in your cells, it gets into your tissues.
Yeah.
Right? But so we're talking on a cellular level here.
You're supposed to take it in a day.
4 a day if you're in pain, 2 a day once there's pain relief.
Together or one at a time?
We prefer divided doses, but if you forget, you can double up. Okay? So whenever we give doses, we always recommend like breakfast and dinner, divide it in half if possible. But if you forget, you can double up, okay? So it also, let me just go back here. Now again, it takes about 28 days to get into your system. It starts working almost immediately, okay, gets into your blood almost immediately, but it takes about 28 days to fully get into your system, okay? And the studies show about 8 weeks, 2 months, for it to really start seeing the significance of it on a tissue level. Okay, now if it's extremities, fingers, toes, wrists, ankles, people usually start feeling it within 2 weeks. 2 weeks. The larger the body movement, shoulders, knees, back, discs, spine, the larger the body movement, the longer it takes. Okay? So always think of that situation though. So any more larger body movement situations, a little bit longer it takes. But every day you take this, it should get better and better and better and better with the situation. So we just talked about some of the dual roles of hyaluronic acid in the joint. Okay, safety profile, one of the safest supplements out there. So those are just some of the studies on that. Again, this is where it got into the bloodstream. Okay, the clinical bioavailability compared to other hyaluronic acid out there. So this is a little bit more on the technical side. This is what medical doctors want to see. Again, this would be the more in-depth research on this. Okay, so we just wanted to show that to you, that there are numerous studies regarding this aspect.
And that's an N of 5, that's 5 people? Or animals, 5 people?
5 people, yeah, on that study, yep. So it just continues, can show on that, clinical evaluation. So we wanted to show that, and then here it is on the wrinkles. Okay, wrinkle formation can help on that aspect as well. So there's numerous studies. We just wanted to give you some examples of some of those studies regarding this hyaluronic acid out there. So again, when a medical doctor says there's no research, that's not true. They're just not aware of the research. So again, that's what we're trying to do, is show them the research and breaking it down for them on this. Okay? So HA, as we said, right? So let's, if you haven't seen that, right here we have 3 sizes, 60, 120, 240. We always start with 4 a day. 4 a day if you're in pain, then back it down to 2 a day once there's pain relief. So that's the middle size right there. If you're doing 4 a day, that's a month's supply. Month's supply on that. Lastly would be fish oil, omega-3D. So fish oil absolutely can help with all inflammation as long as you're taking enough of it. Okay? So again, fish oil is broken down into 2 components, EPA and DHA. EPA and DHA. You want, for pain and inflammation, you want to be at 2 grams a day. Ours are guaranteed at 780 milligrams per pill. So to get to 2 grams, you need to take at least 3 a day. 3 a day of our fish oil. A lot of fish oil out there on the market are 1/3 that strength. So a lot of fish oil out there, you have to take 9 a day to equal 3 a day of these. That's how strong this is. So fish oil is good for thousands of different benefits and organ systems, but especially good for pain aspects of it. We guarantee quality, we guarantee potency, we guarantee purity on all of our formulas regarding this. And let me just switch slides here. It's not on. I wanted to show you this slide. It's not on the presentation, I apologize, but this is something new. It's also on our new literature that we shared with you on the back there for our fish oil. But there's a new way to standardize, or a new way you can test for fish oil. It's an international standard. It's called IFOS. And there's really a 5-star rating criteria here. So you get a star for passing all World Health Organization levels. You get a star for greater than 60% omega-3 concentrate. You get a star for oxidation, PCBs, and dioxin levels all below World Health Organization standards. And we meet all those criteria. We have a 5-star rating on our fish oil. This is the highest standard you can have in the industry. So again, we're just trying to separate ourselves from, from the everyday, because every company has a fish oil. Everybody says theirs is the greatest. But again, these are some additional testing that we're doing. We also put our money where our mouth is. If you go to our website, we actually put our lab analysis on our fish oil, guaranteeing purity and potency. I don't know too many supplement companies that do this. Okay, why? Because our competitors have access now to our lab analysis, and they will test us. And if our fish oil doesn't meet what we say it does, they would use it against us. So that's why a lot of supplement companies do not put this information out in public. But we do some incredible testing with our fish oil. We spend more money than any other fish oil company out there. The labs that we're going through have actually even told us that the testing that we're using, no other supplement company has ever done the amount of testing that we have done when it comes to fish oil. So we feel completely confident that our fish oil is where it should be when it comes to purity and potency on the fish oil. Yes? It doesn't go rancid. We guarantee as long as it is kept out of direct sunlight or at room temperature is really where we would like it to be. Okay? You can always, put it in your refrigerator, but, now it's not such a big problem. Once it gets warmer, then you might want to put it in the fridge. But we guarantee as long as it's at room temperature or less and out of direct sunlight, we guarantee purity and potency until the end of the expiration date. Yeah, we put that flyer on the back for you to see that 5-star rating on our fish oil. Again, 3 a day. 3 a day we recommend for all, minimum, for all pain, inflammation issues going on. Okay? So let's finish that up here. Okay, so a couple other things here I just want to mention. I have some other options. Green lipid mussel. Green lipid mussel is exactly what it is. It's mussels that come from New Zealand. Now, where would we use this? I get the best clinical results with this for shoulders. So any type of shoulder injury, torn rotator cuff, things of that sort. Shoulders are very, very difficult and challenging to heal. They take a long time. But I have gotten some incredible feedback from doctors who have used this. We start with 6 a day. 6 a day if you're in pain or lack of mobility. And then once you get that mobility back, then you back it down to 2 a day. So if that is you or someone you know that has shoulder problems or shoulder injuries, green lipid mussel. Green lipid mussel is what we suggest for shoulder injuries. Okay? Lastly, Sabzam. Okay? Now, Sabzam you can use a couple different ways. Now, if you take it with food, it's a very powerful digestive enzyme. Okay? But if you take it away from food on an empty stomach, and by that I mean either an hour before you eat or an hour and a half after you eat, it's a very powerful anti-inflammatory where there's swelling involved. So let's go back to sprained ankles. Okay, if you have a sprained ankle or any fluid issue, we would dose this at 9 a day away from food on an empty stomach. Okay, 9 a day. The research on these are known as proteolytic enzymes or systemic enzymes. There's many of them that are out there. But the research on proteolytic enzymes goes back to the 1960s with Olympic boxers. And after boxing matches, bruises and swelling that normally took 3 weeks to heal, using proteolytic enzymes, healed in 3 days. In 3 days. So this will literally reduce that swelling for that type of injury. Okay? 9 a day away from food is very important. If you take it with food, defeats the purpose. But I just wanted to mention that because that's another option for you if that is your type of injury situation. Now, will that help with pain? Not so much the pain. Exflame, inflame, that's going to help more in the pain. This is more in the swelling and the bruising. Also great for post-surgery as well. Anybody's having surgery, as soon as they get out of the hospital, Start taking 9 a day away from food. Dramatic improvement in recovery for those type of injuries, okay? I forgot to bring up, we also have a tincture available as well. Inflammation tincture, so if you do not want to do a pill, you do not want to do a powder, okay, or you strictly want to do herbals, the tincture would be 2 droppers full in the morning, 2 in the evening, as far as that goes. Let's also just finally, let's break out that joint solution brochure for 1 second, okay? So this puts it all together for you. So this should make a lot more sense now, because it's everything that we went over. This is the diet on the left-hand side. So these are the foods that we would recommend. And it's an anti-inflammatory diet. So any person in any type of inflammation, any type of pain, this is what we would recommend. We broke it down by the different food categories. We try to keep this as simple as possible. But this is critically important to speed up the healing process by the food. Okay? It's all right there for you. I suggest you put this on the fridge. Take this with you grocery shopping. If you're not familiar with these foods, start making changes. Those little changes add up to big changes. Okay? All right, folks, any questions? Does that make sense to everybody? Yeah.
That explained my massages, like, I talked to her about your product.
Yeah.
She wanted me to get the explain several sales ago.
Yes. Yeah.
And she took the Curcumin product.
Yep.
Didn't help.
Yeah.
She only took 1 explain
Yeah.
and stopped the pain in her.
Stop the pain. Yeah, that massage therapist in Monroeville.
She only took 1.
Yeah, I need to get her name again, so come see me when we're done on that. Yeah, we've had some incredible results. You know, we're just giving you general recommendations here, but we've had results just as fast as that, just at that dosage. So pain is so subjective, so, what's painful for you might not be for someone else and vice versa, but we're trying to give you general recommendations here. I did make some extra copies, so if you have anybody who wasn't able to make it today, please come up and grab the extra copies. But hopefully you like this. And my time is up, and I'll be in the back if you have any other questions. Thank you, and again,